Hey there, ready to level up your medication calculation skills? This video is gonna break down all the different types of medication calculations you'll encounter, from simple doses to complex drips. We'll cover everything you need to know to ace those calculations and feel confident in your work. Let's dive in.
We'll cover dosage question steps, unit conversion, mass for mass dose calculations, mass, liquid for liquid dose calculations, IV terms and abbreviations dose calculations, amount in IV fluid dose calculations, volume, time, IV ml rate dose calculations, volume, time, IV drop rate dose calculations, fluid maintenance requirement, dosage by weight, pediatric safe dose calculation, mass, time, IV ml rate dose calculations. And finally, we'll dive into calculating critical care medications. This section is especially important for those working in critical care units, where accurate calculations are absolutely essential.
First, determine the problem type. Ask yourself, what am I going to calculate? Is it a tablet dosage? Is there a solution involved? Then, identify the values of each variable in your formula. Make sure your units are consistent. Finally, fill in the values into your formula and solve. By following these 4 simple steps, you'll be on your way to conquering any medication calculation.
Let's start with the most important step, identifying the problem type.
So, what kind of calculation are we dealing with? Take a look at what you have. Is it a mass for mass calculation, mass, liquid for liquid, amount in IV fluid, or maybe a volume, time rate? Or perhaps we need to calculate fluid maintenance or a dosage by weight. Don't forget those important mass, time calculations, too.
Okay, we've identified the problem type. Now, let's figure out what we're actually solving for. Now, let's determine the values for each variable in our formula. What's the volume? Is it in milliliters, liters, or something else? What about the weight? Is it in kilograms or pounds? And don't forget about concentration and drop factor. We need to find the value for each of these to solve our equation. Remember, the more precise you are with your variables, the more accurate your final calculation will be. Ensure all units are consistent. Convert volume to milliliters or liters, and weight to kilograms or pounds. Align concentration and drop factor. Consistent units are crucial for accurate dosage calculations.
Let's review some basic key unit conversions. Feel free to pause the video and take your time reviewing these conversions to ensure consistency. Let's tackle mass for mass questions. If we know the mass of each tablet, how do we calculate the number of tablets needed? Use this formula. Divide the ordered amount by the amount you have per tablet. Check out the example provided to see how it's done in practice.
Check this example, solve it, and let us know your answer in the comments below. Feel free to pause the video if you need more time.
Now, what if we have a mass, liquid for liquid order? Given an amount of mass per liquid, determine how much liquid you need using this formula. Divide the ordered amount by the have amount, then multiply by the volume per have. Check the presented example to see how it's applied.
Check this example, solve it, and let us know your answer in the comments below. Feel free to pause the video if you need more time. For amount in IV fluid questions, given a volume of IV fluid and a dosage expressed as a percentage, you can find the mass of the dosage using this formula, concentration % divided by 100, then multiplied by the volume. Check this example, solve it, and let us know your answer in the comments below. Feel free to pause the video if you need more time.
For volume, time, IV ml rate questions, when given a specific amount of liquid and a time period, you can calculate the necessary IV flow rate in milliliter per hour using this formula, volume divided by time. This measurement is used when the IV is regulated electronically by an infusion pump. Check the presented example to see how it's done.
Check this example, solve it, and let us know your answer in the comments below. Feel free to pause the video if you need more time.
Given a certain amount of liquid, a time period, and a drop factor, GTTS per milliliter, how do you determine the necessary IV flow rate in GTTS per minute? This measurement is used when the IV is regulated manually. Since it's not possible to administer a fraction of a drop, it's common to round your answers to the nearest whole number.
In this case, to find the necessary IV flow rate, use the following formula: volume in ml divided by time in minutes, multiplied by the drop factor, which is in GTTS per milliliter. This will give you the flow rate in GTTS per minute. Check this example, solve it, and let us know your answer in the comments below. Feel free to pause the video if you need more time.
Given the weight of a child or infant, how do you calculate the necessary amount of fluid per day? While different hospitals may have various policies, you can use the commonly accepted table of fluid requirements for learning pediatric dosage calculations. Check the below table and then example on the right side of the presentation to see how it's done.
Check this example, solve it, and let us know your answer in the comments below. Feel free to pause the video if you need more time.
For dosage by weight questions, given the weight of a patient and a dosage specified per unit of weight, calculate the necessary dosage. These problems are a type of pediatric dosage calculation. Use the formula: weight in kilograms multiplied by the dosage per kilogram.
Go through the following example and see how it was solved. A doctor orders 200 milligrams of Rosefin to be given to a 15.4 pounds infant every 8 hours. The medication label shows that 75 to 150 milligrams per kilogram per day is the appropriate dosage range. Is this doctor's order within the desired range? Check this example, solve it, and let us know your answer in the comments below. Feel free to pause the video if you need more time.
We've reached the second to last formula in our lecture today: mass, time, IV/ml rate questions. Given an order in quantity of mass per time, determine the necessary IV flow rate in milliliter per hour based on the given mass per volume. These types of problems are common in critical care nursing. Use the formula: ordered amount per hour divided by the have amount, then multiplied by the volume. Check the presented example to see the application.
Check this example, solve it, and let us know your answer in the comments below. Feel free to pause the video if you need more time. We've reached the last formula in today's session. To calculate critical care drugs, you need 4 basic elements: the ordered amount of the medication, the patient's weight, the number of minutes in an hour, which is always the same, and the dose per milliliter. Please check the presented formula to understand how these elements fit together.
Let's take this example and see how it should be solved. Your 65 kilograms patient has dopamine ordered at 6 mcg per kilogram per minute. The IV contains 400 milligrams of dopamine in 250 milliliters. What is the correct IV rate? First, calculate the concentration, then make the unit conversions so that all units in the formula are consistent. Finally, insert the values into the formula to find your answer.
Now, let's put the formula into action. Take the ordered amount of the drug, multiply it by the patient's weight, and then by 60, to convert minutes to hours. Divide the result by the calculated drug concentration to find the IV rate. This calculation gives you 14.6, which we round to 15. Therefore, set the IV rate at 15 milliliters per hour.
For the final slide, I've provided you with 8 questions about drug dosage calculations for critical medications. Feel free to practice these on your own or use them in your presentations. They're a great way to reinforce what you've learned today. You can also leave your answers in the comments down below.
Thank you for sticking around until the end of the video. If you'd like a copy of the presentation, please like, share, comment, and leave your email in the comment box below. Let me know what other topics you would like to learn about. See you in the next session, and take care.